Hi, I'm Susanta Bidari. Welcome to my presentation today on trauma-informed care and recovery-oriented practices to address intergenerational trauma in Aboriginal and Torres Strait Islander communities and promote cultural safety and healing in our care system. Before I begin, I would like to do the acknowledgement of the country. I want to begin by acknowledging the traditional custodian of the land we join today. For me is Ghana land, and I'm extending my respect to their elder past, present, and emerging. I acknowledge Aboriginal and Torres Strait Islander peoples' profound spiritual bond with land, rivers, and skies. Their resilience, determination, and wisdom guide us as we progress toward healing and reconciliation. I will begin with brief information about Aboriginal and Torres Strait Islander experienced trauma. Then I will discuss trauma-informed care implementation challenges and offer policy, cultural, and practice solution. Third, I will assess the significance and potential effect of these changes. Finally, I will conclude this talk with a brief conclusion and a takeaway. Let's talk about background and barriers. Aboriginal and Torres Strait Islander people in Australia experience the trauma resulting from colonization, forced separation of children from their families, the prejudicial policies such as the stolen generation. This experience have resulted in a cycle of intergenerational trauma which persists today as a social isolation, mental health issues, and the substance abuse. Historical trauma is intergenerational and perpetuates mental health issues as demonstrated by elevated rate of psychological distress, suicide, and substance addiction in these communities. Trauma-informed care prioritizes comprehension of the effect of trauma on individual and communities. We must address the significant aspect of trauma which is substance abuse, widespread among the indigenous community as a means of coping mechanism. Indigenous Australians have a five-fold increased likelihood of hospitalization for alcohol-related condition in compared to non-Indigenous Australians. This underscores the profound effect of trauma on emotional and mental health, emphasizing the necessity for trauma-informed care approaches. Let us focus on barriers to implement trauma-informed care. Trauma-informed care is essential for facilitating healing in Aboriginal and Torres Strait Islander community. Nevertheless, substantial obstacles hinder its adoption. Systematic racism and institutional prejudices frequently result in distrust towards healthcare practitioners, which is intensified by insufficient cultural competence and resources constraint. Aboriginal individuals frequently exhibit a disproportionate prevalence of adverse mental health outcome while being inadequately represented in intervention aimed at effectively addressing trauma. Service devoid of cultural safety may result in re-traumatization instead of facilitating healing. Systematic racism is profoundly ingrained in Australian healthcare and social system. Systematic racism restricts service access for indigenous population and reinforces their trauma. Cultural competence. Numerous healthcare services lack the requisite cultural awareness to support Aboriginal communities successfully. In the absence of culturally competent care, there exists a danger of deteriorating trauma due to the misdiagnosis and unsuitable treatment method. Institutional biases, healthcare policies frequently neglect the specific need of trauma survivors, resulting in disempowerment and distrust. This obstructs proper care and may impede rehabilitation. Let us dive into the recommendation for evidence-based practices. First is organizational culture. Substantial organizational cultural change are necessary to overcome these barriers. Trauma-informed treatment underscored the significance of establishing trustworthy relationships with individuals and communities. For Aboriginal and Torres Strait Islander individuals, this entails establishing environment that recognize their historical trauma and foster a sense of safety. Organizations must integrate trauma-informed principles, including safety, trust, and empowerment throughout all tiers of service delivery. Transitioning from conventional hierarchical model to collaborative methodologies is crucial for fostering healing, particularly for marginalized people. It urged healthcare organizations to prioritize training workers in trauma-informed care and cultural competencies, assisting staff in identifying indicators of trauma and reacting with compassion and comprehension. The distinct historical context of trauma within the Aboriginal communities underscore the necessity of this training. It enables clinicians to prevent re-traumatization and foster more robust therapeutic interaction, focusing on the principle of trauma-informed care. Second is recommendation for policy and procedures. Policy reform need to promote the incorporation of trauma-informed practices into healthcare system. Utilizing trauma-informed communication technique will enhance collaboration and empowerment. Implementing trauma-informed communication practices helps ensure the individual feel acknowledged and esteemed in their recovery journey. Empowerment by collaborative decision making is essential for individuals to perceive autonomy in their recovery. Furthermore, policy must prioritize the reduction of coercive behavior like restraint and confinement, which are especially detrimental to trauma survivors as they result in re-traumatization. By diminishing these practices, we can foster a safer and more supportive atmosphere for healing. Moreover, policy must incorporate trauma-informed framework prioritizing person-centered care and cultural competence. By integrating national mental health initiative with trauma-informed care concept, government can enhance service delivery outcomes for trauma survivors. Incorporating trauma-sensitive practices into health standard and financial frameworks guarantees that these models are theoretical and practical. Third recommendation is for professional practice. Professional practice should incorporate a profound understanding of trauma and cultural competence, particularly about Aboriginal and Torres Strait Islander health. Practitioner must acknowledge the health for this individual encompasses emotional, spiritual, social, and physical well-being. Healthcare professional training should prioritize cultural competence and trauma-informed approaches to address the cultural significance of community and land in Aboriginal health while delivering holistic and person-centered care. It is essential for practitioners to comprehend the neurobiological and social impact of trauma, promoting autonomy and shared decision making to counteract power imbalances contributing to past trauma. Culturally safe practices are crucial, as well as incorporating traditional healing practices of these communities into mainstream treatment. Let's focus on assessment of recommendation. The recommendation targets trauma-related behaviors such as substance misuse and mental health issues, making them indispensable. Trauma-informed care, with its focus on safety, empowerment, and the crucial element of collaboration, is crucial in reducing re-traumatization and promoting long-term healing. It also emphasizes the importance of a supportive team in the healing process. Healthcare systems with the active involvement of professionals play a pivotal role in increasing personal engagement by promoting safety and trust. Trauma-informed practices increases community resilience because supported and understood people are more likely to create meaningful relationships and recover from trauma. These practices are necessary because trauma-informed treatment improves recovery outcome, including decreased crisis service usage, mental health, and individual participation. Trauma-informed care addresses the core cause of psychological distress rather than treating symptoms, reducing the risk of victimization, and promoting long-term well-being. This modification can prevent traditional care model-induced re-traumatization. Trauma-informed recovery-oriented methods, which focus on individual journey to recovery and their strengths, play a pivotal role in building trust and safety, which are essential for rehabilitation, particularly in marginalized communities. Trauma-informed care addresses acute mental health needs and considers the long-term socioeconomic determinants of health. Let's conclude today's presentation. Trauma-informed recovery-oriented practices require significant organizational policy and practice reforms. Atkinson on 2019 paper emphasized that organizational cultural, policies and professional practice can be changed to enhance health outcome and empower individuals to manage their rehabilitation. This adjustment will create safer and more supportive environment for long-term recovery and resilience. And thank you everyone for joining today's presentations. Right, here are the references. Yes, bye.